Hi, I'm Dr. Kristi Vaughan, and I am a functional medicine practitioner, which means I really help patients get to the root cause of what's going on, their problem, what they're struggling with. And when I say root cause, we look at what is driving their symptoms and how to correct that,
Yeah.
right? Versus a, one one size fits all approach. We're really addressing like what is the drivers behind your symptoms,
Yeah.
and it could be multifaceted. So that's what I do. I love it, and I do it here in California and licensed in different states. So that opens up like
Hmm.
some telemedicine options.
Yeah.
So yeah,
So, what got you into functional medicine?
I started functional medicine with my own personal experience. I was working for a corporation in the business world. I'd get sick several times a year, and I was referred to a functional doctor, which said, "Hey, you know what? I was going to have my tonsils taken out," and he said, "I think I can help you. Worst case scenario, try this. It doesn't work. You have your tonsils taken out later." And I thought, you know what? That's the best idea ever.
Hmm.
Like a more holistic, natural approach, and then go to, drugs and surgery, right? So, fast forward to today, I rarely get sick, if ever,
Hmm.
and I still have my tonsils.
Hmm.
And then, second time I was introduced to functional medicine is I was in medical school. I was studying functional medicine. I already knew I wanted to be holistic, more natural, and I was studying functional medicine. But before medical school, I'd had my mercury fillings taken out,
Mm-hmm.
and I had symptoms of fatigue, brain fog, body aches, and bone pain. And I was studying functional medicine, so I started to apply functional medicine to myself because I had went to conventional doctors, said these are the symptoms I have, these are the things going on, and they were like, "You're fine. Your labs look fine. Everything's fine. There's no issues." And I'm like, "I don't feel fine. I know myself."
Hmm.
So I started using what I was learning in functional medicine to myself, and I had my heavy metal toxicity was off the charts.
Hmm.
I had a subclinical thyroid issue, which means if I hadn't have treated the heavy metal issue, it would have thrown me into a thyroid disease. But after doing the treatment, within a week or two, I started feeling better. Brain fog lifted, body aches lifted, and treated myself for a couple months on heavy metal protocol.
Wow. So, how long have you been actually a functional medicine doctor?
I've been practicing. Whoa, that's a good question. I have been a functional medicine doctor for 15 years
Wow.
or more. Yeah.
All here in Orange County.
Yes.
Yeah.
Yep. And I was doing holistic, working with patients prior to being a doctor, um, using applied kinesiology, muscle testing, doing some emotional clearing, some more of that kind of nutrition response technique and nutrition testing
Wow.
before being a doctor. So, sort of like I've been treating for like almost 30 years. See,
Wow.
now I'm aging myself, right? But a doctor for over the 15, almost 20 years.
Wow. Okay, so we were talking earlier. Not a lot of people truly, from my experience, understand what functional medicine is,
Yeah,
and it's also been called integrative medicine.
yeah.
So, what is functional medicine?
It's a great question. I think a lot of people don't know. I think the best way to look at it is there's two different models of care. There's the conventional, right, which is you go to the doctor, they look at what's going on, they're trying to establish the treatment is typically prescription,
Mm-hmm.
surgery, and they might say change your diet, right? Or don't do this or whatever, eat less or something like that. When and that's a conventional approach. When you're looking at the other, it's usually in the complementary alternative, which would be functional, integrative, even acupuncture, even chiropractic, even, these kinds of things are not conventional approach,
Mm.
right? So now we're into the complementary alternative medicine. And functional medicine is in that category.
Okay.
And it's
Wow.
it's like integrative or functional is, you could really call it sort of the same. And functional is really specialty testing that's looking at what your root cause is to help determine the best approach to heal the driver's cause and symptoms.
Hmm.
And so it's based off of scientific research and approach, but it's looking at, again, what are the root causes that are driving your symptoms. So fatigue could be, toxicity. It could be adrenal issues. It could be, brain issues. It could be nutrient deficiencies. It could be immune issues. There's a lot of different factors that could be a driver, and you got to look at all those approaches.
So with all this, the core of it, though, you're looking at their blood
It's a great
to
question.
test all that.
That's one thing that we look
Yeah.
at. But this is where patients come in and go, Dr. Vaughan, I've done all these tests. I've done a lot of tests with my conventional doc, and it was all fine. And I'm like, because the blood work is not looking at the whole history.
Yeah.
And oftentimes blood work through a conventional doc has gotten smaller and smaller and smaller if you haven't noticed.
Mm-hmm.
And that's because insurance starts to pay less and less and less.
Mm-hmm.
Or doctors say the insurance won't pay this, or whatever the case may be. So blood work is one test, but there's many different tests in a functional world that we can do that really points to what is the root cause. For example, yes, we do blood work, but our blood work is like 160 lab markers versus, I don't know, 20
Yep.
or 10. We're looking
Wow.
at, a full thyroid panel. We're looking at, the lipoprotein particle sizes. We're looking at your autoimmune markers. We're looking at your A1C, your vitamin D, all these things.
Yeah.
And specialty tests, which we can look at your gut.
Mm-hmm.
A comprehensive panel for your gut is 6 pages.
And that your GI map, is that what we're talking about?
Yes, exactly.
So that's something so you're looking at, you can test their saliva, you can test their stool and their blood and their urine,
Yes.
right?
Yep. So we can test a lot of different factors through that. So the stool, we're looking mostly for gut issues, right? But we can test their urine and their blood for heavy metals. And, urine and blood for hormones. Or saliva for adrenals, or, stuff like that. So we look at your heavy metals, we look at your toxic burden. We can look at your mold assessment, see if you are being affected by mold. We can look at your, brain, your neurotransmitters.
Mm-hmm.
We can also do a completely separate, not like by testing blood, saliva, or whatever, but we can do a QEEG, which tests your function of the brain and what the brain waves are doing.
Yeah.
So I like to tell patients each test tells us something different.
Yeah.
And a blood work is just a simple look, and it doesn't give us the full picture, especially in a conventional approach, because it's being guarded by insurance.
Okay, so that's the part I want to get into in a little bit. But the thing so I was having this meeting today with this clinical team, and I've seen multiple clients with this certain scenario. They come in very depressed, low energy, can't sleep, whatever. And they're very quick to get on medication. But in that space of behavioral health, which we have 1,100 licensed facilities and just out here, right? Do not look at their blood. They don't look at their gut, any of these things. And, with an addiction, you have a thought, which triggers this emotion, which triggers this reaction being substances to mask your, emotions.
Right.
Do you feel that functional medicine, looking at and doing these tests, can correct how you can, you think that would be beneficial to go and look at all these other things before doing the medication?
Absolutely. And I'm glad you led with that and said that, because absolutely. I mean, from where I stand, your body is meant to heal naturally given the right tools and guidance.
Yeah.
So therefore, whether you're coming in with mental health or addictions or gut issues or thyroid issues or optimization,
Yeah.
right? We want to look at what are the drivers. And if for example, mental health or addictions, if you're not looking at the gut brain connection,
Mm.
you're missing a huge part.
So what is the gut brain connection?
So the gut brain connection is your gut, it talks to the brain through a vagal nerve and also through neurotransmitters and the biofeedback, the negative feedback loop and biofeedback system. So what we want to do is we want to address like gut related issues because bacterias can have a factor of brain health, can have a factor of neurotransmitters. 80% of your immune system is in your gut. Um, a huge percentage of thyroid conversion happens in your liver and your intestines. So if these things are not happening and that gut brain connection talk is miscommunicating, misfiring, then there could be all kinds of symptoms that a medication won't really help
Maybe just mask,
mask.
right?
And this is where I like saying, like, first, do no harm,
Yeah.
right? Which means more of a holistic approach, more gentle, support the body's natural way to heal, look at what are some of the drivers affecting the symptoms, and then, if need be, go into the medication surgeries approach. We need both sides. We need a conventional approach, obviously. We need that. If I'm in an emergency situation, you don't want me helping you. I mean, I'm great in emergency situations, but I'm not going to do surgeries,
Yeah.
right? But also you want someone that's trained in the more natural approach to weigh in on your healthcare and treatments and treatment options versus going straight to a medication.
So, okay, with food being a huge part of this, right? I think what I heard is that 90% of your serotonin is produced in your gut, something like that, right?
Yes. Yeah.
So with what you eat can make you feel a certain way.
Absolutely. Yes. I yes. There's a lot of dopamine hits when you're eating certain foods too, right? So if you're sensitive to certain foods or allergic or have that addictive kind of craving towards, I don't know, gluten or dairy or sugars,
Yeah.
which is some of the common foods I see, right? It can give you that dopamine hit, and that's why it's so addictive and wanting to continue to eat it, right? And so this is where people don't think about the food is
Yeah.
what you eat, and you are what you eat,
Yeah.
and you are what you digest. So it's important not just to watch what you're eating, but how you digest the food.
Wow.
But this can trigger the serotonin, dopamine, epinephrine, cortisol, all these things that we want to give balance to and not have anything too high or low, right?
So for someone just that is never experienced functional medicine, now when a typical client that would come in, are they coming in for a reason of not feeling well? And what happens when a client first comes in to your clinic? What are they typically wanting? Like,
That's a great question. I mean, I think for the most part, obviously, I wish more people came in feeling well, right? I
yeah,
do have a population of people that are just wanting to optimize,
yeah,
sort of like me. I know this is the best way to do health,
yeah,
and I do this on a daily basis, like the functional, more holistic, more natural. I'm mindful of what I eat, exercise in mind body connection. And then there's the patients on the flip side that are diseased, whether it be diabetic or autoimmune or thyroid or mental health or concussed syndrome or cognitive decline, or people just having gut issues, many different gut issues, whether it be bloating or diarrhea or constipation.
yeah,
So I think it can span from healthy people to very sick people. I mean, some people come at the end where, unfortunately I've had to turn patients away because they're just too sick.
Oh, really?
And that's the hardest part.
Mm.
Of course I want to help them, but at some point it's the risk benefit ratio, but also for the patient, it's almost sometimes when their organs are failing, there's
Yeah.
not a lot of help you can do on a functional level. I mean, there's still things they can do, but
Yeah.
you know,
When they're a little far, say gone,
yeah.
but hmm.
And
So
and that's the hardest thing is
yeah,
you don't want to see, and this is where I tell patients, like, take care of it now, because if you don't take care of it now, it will become a 10 times worse issue a year,
yeah,
2 years. It's going to exacerbate. Things don't just usually go away and get better.
yeah, and that's the thing that when I have this conversation with a client or whatever, a colleague, and I think when you look at like they think they're eating good. Some people, they really think they are,
Yeah.
right? And the body doesn't lie, right? Like you can see that if someone's been consuming a lot, but this will happen with clients of mine that I'm like, hey, like, how, how are you eating? Oh, I'm eating chicken breast. I'm eating all this, but I've been working with you for like a year, and I haven't seen you trimmed up
Right.
at all.
Yeah.
And I think this part with food, like, food is such a big thing right now. And if you were to give someone suggestions on food, just the fundamentals from your perspective, how should the general population eat? Is there a time that someone should eat? Like, how does that work with you? Like, say if someone hasn't came to you yet, do you
Yeah.
have, like, from your perspective, the best time to start eating, to stop eating, and what to actually consume that people can just do that they don't know?
Yeah, I think it's very individualized, right?
Okay.
Depending on who you are. I mean, some people can do intermittent fasting, and for a lot of women in menopause and perimenopause, it's not really great for them,
Okay.
right? So I think across the board, the most important thing is I prefer having meals early in the morning, like
Mm.
eat earlier, start your metabolism, and finish eating earlier,
Mm.
right? So if you're gonna, you know, what's your window of eating, I would prefer eating earlier and being done and fasting through the night,
Okay.
right? So that would be me.
Why would that? Why do so?
Because the later you eat, the more, then you're going to bed. You don't want to go to bed on a full stomach,
Yeah.
right? So I like that fasting window to be, closer towards an earlier night or earlier day,
What about going to bed though with a full stomach is bad?
because it secretes like cortisol, and your glucose goes up, and you got blood sugars dysregulation are high. Then your glucagon secretes in the gallbladder and the liver. These functions are happening, and then your cortisol is spiking because your blood sugars are dysregulated,
Mm.
um, and then you're going to bed on a full stomach.
Yeah.
Like, you don't want to do that. You want to have 2 hours post food before going to bed, at least.
2 hours?
Yeah,
Okay.
ideally. And then I think if a person could eat low grains and no gluten, ideally, low grains and protein, vegetables, and fruit, um, organic as possible, I think that's a safe, you know, sort of mixed Mediterranean diet is a safe way to go, and usually helpful and healthy for most people.
Okay.
But again, it's individualized.
Yeah. That's true. I mean,
Yeah.
okay. Now, I have some questions here that I want to ask you that we put together. So, one question people often, I guess, okay, this is different then. Is functional medicine typically covered by insurance?
Yeah, so oftentimes functional medicine is looked at as not medically necessary.
Hmm.
So therefore, insurance only pays for things that they deem medically necessary. Now, if you have a PPO and you have out-of-network benefits, typically what we do is we give you a super bill, and you could submit that super bill into insurance, and it will reimburse if you've met a deductible and if you have out-of-network benefits.
Hmm.
But I tell patients, it's sort of like a car. When you go buy a car, maintenance on the car is not paid for, right? So this is what insurance really is. It's supposed to be used for catastrophic events and visits here and there, or if you have a major disease and need uh, office visits a lot. But don't use your insurance as your health care,
Mm.
right? Pay out of pocket to do healthcare visits because really healthcare is there to really cover you in case of catastrophic events, emergencies, stuff like that. Higher paying expenses, but use out of pocket, pay out of pocket for these ongoing care to maintain your health.
Yeah. Wow. So functional medicine is just not. Is it ever going to be covered?
Well, in my book, I'd prefer it not because they're not going to pay
Yeah, they're not
functional
gonna pay.
medicine practitioners to spend 30 minutes or an hour with a patient. That's the problem. If insurance gets involved,
Yeah.
then the time gets cut down because they have to do a high volume because reimbursement is low. And it's this,
Yeah.
you know, catch 22 if insurance gets involved because then they're really telling the doctors what they can and cannot do.
Well, then if you look at it if then you have to pay cash, the general, I don't say general population, but it can probably add up. For the general public, some people aren't willing to invest money themselves. What I see, I was just talking with the therapist I work with. So many people are so willing to invest in these things, right? A purse, a car, a trip, or this or that, but into their health, I don't see people investing as much as they do in these other things.
Which is really sad.
It's
I
kind of,
mean, we're in California, which is supposed to be one of the healthiest,
yeah,
places to live, right?
yeah,
But I mean, unfortunately, I think people are prioritizing, purses and clothes and cars and vacations over taking care of their health and being well and and I hear it a lot and I think it's just where do you prioritize?
yeah,
Like my I know that if you don't have health, you have nothing. Health is wealth,
mm,
right? And so therefore a lot of times people spend so much money at the end of life trying to get healthy
yeah.
versus the money that they could have spent throughout their life to stay
Do
healthy.
you see that?
Yeah. Oh yeah.
Oh
They
gosh.
come at the end when it's just like where were you 10 and 20 years ago where this would have been a simple fix
Yeah.
or a correction that could have changed your life or saved your life, right?
Yeah. I remember we were talking at your office too, and it doesn't have to be this really dramatic thing, what you're talking about. Like, we're talking about just walking. Now, like these basic things of what can kind of keep somebody well.
Yeah.
It's basically what you consume, right? And then to move your body. Like if you were to have someone and recommend to stay healthy, what do you recommend? Like what do you suggest someone at the fundamentals to not overcomplicate this?
Yeah, I mean,
Like your philosophy, that's what we're talking about. Like what is your philosophy on this?
my philosophy number one is that our body is meant to heal naturally given the right tools and the right direction, which starts with you and
Mm,
me, right? Ourselves. So that's number one. That's my philosophy. So that means, you know, what I typically do, and you want a holistic doctor or a doctor that is healthy, right? I
yeah,
do.
ideally, yeah.
I want an example. So
Yeah.
what I do is I prioritize movement. I prioritize, prayer, meditation.
Mm,
I try to, get centered and clear my body and my mind so that I can do my day. That's how I start my day. Then I go to the gym or go exercise at the beach or go for a walk or whatever it is, whatever time yoga, whatever time I have for.
rollerblading.
Rollerblading, that would be awesome. Yeah.
I know that's coming.
Yep, it is coming. And then, water, half your body weight in ounces of water.
Hmm,
And then, organic, real food, as much organic food as possible, but real food, not processed food.
yeah.
And staying away from the inflammatory foods, which is the gluten and the sugar and the dairy, as much as possible. And, also the mentality, think about your thoughts. What are you thinking? What are you saying to
Mm,
yourself? What is your energetics, right? Like, how are you appearing and presenting yourself to the world or yourself,
Yeah.
right? So what are you saying? Because what you're saying creates an emotion, creates your reality.
Mm.
And so I think that's important. The other thing is, you know, all disease begins in the gut. I really believe that. There's a gut-brain connection, so that affects the brain. So most people have never healed or looked at their gut health.
Mm.
And people think pooping once a day or every other day or every 3 days is normal.
I know. I heard that's not.
Yeah, it's definitely not normal.
Once a day is not normal.
No, that's not normal. You should go to the bathroom 30 minutes after you eat, ideally. Now, there's
That's
not
so
many people that
wild.
are doing that. So that
That's-
tells you how unhealthy we are.
You should after 30 minutes after?
30 minutes after. It's the processing for digestion.
That's so wild.
But because of our sympathetic, stressed out, nervous system,
Yeah.
that vagal tone is affected, and that the release and relaxation's not happening.
Because of what, this anxiety filled time, or I would say time in life, but this always on the go and kind of just in this fight or flight,
Yeah,
that affects all of that.
absolutely. It affects our,
Wow.
nervous system, which affects our digestive system and our brain. But it's not just that. Again, it's what we eat.
Yeah.
If you're eating genetically modified food or non-organics, or that affects these factors as well. And I also truly believe that people suffer needlessly.
Hmm.
There's too many people that are not having the best health.
Hmm.
And it blows my mind.
Isn't obesity like 46%?
Yes, and we're one of the most educated countries in the world, right? And smartest people, and have all the resources possible. But there's also fast food on every corner, and
Yeah.
what people eat and how they treat their body
Yeah.
is not healthy. And so I think it's about that compounded effect, Compounded effect, people really recognize that in the money category.
Yeah.
Right? But what about in your health? So whatever you're doing, compounded over time is what you're going to get. You're not going to get away from it. Some people might.
Yeah.
They might. But in the end, it will catch up with you, at some point, right?
Well, because you mentioned, this, how you can heal your own body. And I totally believe in that. And I think, but I want to ask, the way that you speak to yourself and the way that what is it? I was thinking that I was up in Joshua Tree on Monday night, kind of tuning out, getting out of here.
Good for you.
And
we all need to do that more.
I had this thing, I was sitting there, and it was, you're not your thoughts. You're a product of your thoughts. Change your thoughts, change your life. Being a product of your thoughts, can that also affect your body as well?
Absolutely, yeah. A lot of research is done on cancers, and cancers are created by dysfunction of the tissue, right? Your body's gone awry. So cells are not functioning, they're going awry, but it can also be your thoughts and your emotions that are creating this dysfunction. And we've seen it, cancers get healed by, doing the inner work and the outer work, of course, right?
Yeah.
But doing inner work can also make big changes. And what you're saying to yourself, your thoughts, your, rumination of thoughts, right? Unconscious thoughts, because, 70 to probably even 90% of our thoughts are unconscious.
Yeah.
So if we can start to be more aware of what we're saying to ourselves and what we're, how we're communicating to ourselves and treating ourselves, are we positive? Are we negative? One, we'd probably achieve our goals a lot faster, and we'd be a lot healthier.
Yeah. Yeah, more of a pleasure to kind of be around. I think that was the thing that I did when I went up to Joshua Tree. I was, I think it's just the time that you just to kind of get away and have to either maintain or rebuild this relationship with yourself, to be a pleasure to work with.
Yeah.
I think it can be such a hustle mentality, based on where we're at too.
Yeah.
So go, so fight or flight, so afraid of the future. And to be honest, I was caught up in that myself. And I'm normally very easygoing, like, but I got just so wrapped up in all this, and I was like, okay, Preston, you gotta go.
Yeah.
You know? Um, yeah, I mean, I think I don't know if enough people do that. I had people go and ask me, like, you just went by yourself? It's like, yeah, because I enjoy my own company,
Right.
you know?
A lot of people don't know what that's like.
Yeah, I can't be suggesting people, how to change their life and not, leading from where I live too, right?
Yeah,
Yeah,
absolutely true. I think it's important to, again, get quiet, get still,
yeah,
be alone, but center yourself, prayer, meditation, whatever, works
yeah,
for you, and clear your thoughts, but also, at that moment also let go of things, surrender, like there's a bigger plan,
yeah.
right? And
Surrender, yeah.
there's only so much you can do. Long as you're doing your work and being guided by what you're doing, then then everything will work out.
Yeah. How do you feel about that in your life? Do you feel, like you found your path? Like, do you feel very aligned being a functional medicine doctor?
I do. I mean, I'm very fortunate. I really am. I mean, but it wasn't, you know, it wasn't a straight path. It
Yeah.
was me listening to my gut,
Mm,
right? I mean, my first degree was in business because, I was working in a corporation, and it was more natural, and it was help with education, and I love business, so that's what I did. It
mm,
made sense, right? I wanted to pursue the doctorate avenue, but was afraid of all the education and all
mm,
that kind of stuff. And at one point, I was actually walking in Laguna and had just paid off my undergrad,
mm.
and wanted to go back to school and to go back to school, and went, oh my goodness, I'm going back to school. And I started crying
Oh, wow.
because I was so excited that I finally just had that spiritual moment that, okay, this is what I'm doing.
Wow.
So yeah, I mean, I listened to it. I resigned from a really good job and just pursued my passion, and decided to go for it. And I'm glad I did, because every day I wake up, I love what I do. My patients make my journey so much easier and so much nicer.
Yeah.
And you know, what better job than to see people's lives change
Yeah.
and people heal and like recover their health? But more importantly, it is their health, but it's the things that they're missing out on,
Mm,
that they can't do, that they can't spend time with their family, they can't go do activities with their family.
yeah.
They want to be around for the grandkids. They want to go, in retirement and travel with their husband or their wife, and they can't because they're, not active, or, not feeling well.
Yeah.
So it's these things that I get to hear, their favorite hobby that they can't do anymore, surfing or golfing, or, these things get to come back in their life after they've done the work and we've worked together, and they're crying oftentimes.
Yeah.
I mean, I remember one patient, um, she was a single mom, and this is priorities, and I want to give this testimonial or example because she was a single mom. you know she had just quit her job because she couldn't work. She was that sick, that unhealthy,
Mm,
and she was terrified. She didn't know what she was going to do, and she came to me, and I said, look, it's, yes, you're going to have to pay out of pocket, but the alternative is you're going to stay where you are, you're going to get worse, and you're not going to feel better. Long short story, she trusted me. She did the work. She signed up for care. She did functional medicine and the brain treatments. And she, a couple weeks into it, energy started coming back, better sleep, feeling better, feeling more in her body. And then fast forward, she was like, I am so glad I took a chance and did this work. I mean, almost every appointment, she was in tears, so grateful
mm.
of how much change and how much better she had felt.
Yeah.
And she had also, had cancer treatment, breast cancer treatment in the past. And I think that was part of it too.
Yeah.
And so she was feeling so great and was just so happy that she had taken a chance, put her health first, made that a priority, and it was like a completely 180 from where she was.
Wow.
Yeah.
And how long was she with you for?
She was with me for, I think, 4 months.
Oh, really?
Yeah.
Just committed.
Yep. Just committed and dug in. And that's what I tell
It's
patients.
nice
Like,
seeing commitment though, huh? I
yeah,
bet.
it really is. But I also tell patients, like, give me a month, give me 3 months, give me 6 months, and your life will change.
Wow.
Like, it's that quick. It's
Yeah.
that simple. You don't have to wait that long to start seeing changes. Like, literally, oftentimes patients start seeing changes within a week or two. But, a couple months can make a huge impact and a big shift in your life.
Well, I mean, yeah, because then you start to get, they say a couple months in, you start to feel really good. Like then you start to attract all of these things.
Right.
You start to, when you're in a negative space, you only get those calls. You get negative phone calls, right?
Right.
It's just
Yep.
so weird how it happens. But when you're just vibrant and radiant and healthy and fit, like the world, you know, your perspective of the world change. What is that thing? How
Absolutely.
you, the world reflects how you feel inside,
I love that. That's really great.
right?
It's so true. I mean, how can you not feel great when you're, but a lot of people don't.
I wonder how many people on one of these houses here are just so upset.
Yeah.
And how much they need Kristi.
That's absolutely true. I love that.
You don't
And
even know.
yeah, I love that. It's true. I
Yeah.
mean, I think, one thing is also being grateful.
Yeah.
I mean, it doesn't matter how great your life is or how bad you think your life is. You can always find someone that's got it worse than you.
Yeah.
So gratitude is huge. I always try to tell patients, like, when you are grateful for the little things, you get more of that,
Yeah.
right? So, even if it's a slight change, that means we're moving the right way.
Yeah.
And say thank you,
Yeah.
and be grateful for that change, because that means you get more of that. If you're always like, I'm never going to get better, I'm never going to, like, I see patients sometimes like that. And honestly, if you're showing up like that, there's not a lot that will make you feel better, because you've already got your mindset that you're not going to get better.
So programmed. Huh.
Yeah. And it's really sad. Like, you,
Gosh.
you try to do the mind body, spiritual treatments when you're working with patients like that, but sometimes people are not ready or can't get past their own self, if that makes sense.
It totally makes sense. How's your, where are you originally from?
Originally, I am from Atlanta,
Okay.
so Georgia. Yeah.
Wow.
And I moved here probably almost 30 years ago.
Wow.
Yeah.
Gosh. Did you know anyone out here when you just came out to Orange County or?
I knew one person that I graduated undergrad with, and we were, always flying, trying to meet each other and do vacations and stay in touch and stuff like that. And she was like, "You need to move out here. You would love it." And then one day I just needed a change and went for it, and thought I didn't think I was going to live here,
Oh no.
And then you come stay here for an extended time. It's hard to leave,
I
right?
know. Right. 100%.
Yeah.
So now with like for the future for Kristi, where do you see yourself going with this right now? Is there anything that is getting you excited about functional medicine or the direction that you're going? Or,
Yeah, I think, I mean, number one, I love what I do. I want to build a team, but I want to more importantly, impact more people.
hmm,
I want to impact more people so that my team can, whether functional medicine attracts you, or, you know, acupuncture attracts you, or, you know, I don't know, yoga or whatever, start doing these things that you like. And um, I really want to make a big impact, because again, I feel like so many people are suffering, whether it be, you know, unhealthy
yeah.
the body, or unhealthy the mind, or the spirit. I think, that connectedness needs to happen, and I think that's something that a conventional approach doesn't do.
Yeah.
And so many people, it could be a drastic change and a quick change. So, a bigger impact, helping more people, speaking on, more platforms, stages, getting the word out there more.
Yeah.
But also empowering people. I think it's important to, you know, tell a story, have people connect. I mean, I'm just a person too. And I'm so grateful that I do this work, because selfishly I do it for myself, right?
Yeah.
I do it for my patients, but the
Yeah.
reason why this career and purpose fell into my lap is because it resonates so well with me, because like I do this kind of stuff for myself. Like
Yeah.
I am, you know, I tell my patients I'm high maintenance in a way, right? Like I need to take care of myself and do these things for me so I can take care of you.
Yes.
And
I
I
was just
use a
saying that.
toolbox of a lot of different things over the last, many years of being alive. Um, and I do a lot of different things for myself. And that's the referral basis that I have. I refer treatments that I've tried. I will tell you if I haven't tried the treatment before, but I like trying the thing before I refer the thing,
Yeah.
if that makes sense.
Yeah, when you said on treatment though, like I do know within functional medicine there is these things that are pretty incredible. One of the what is that you can get all the inflammation? What's it called? You take the blood out and it filters all of this inflammatory. What do you have? What do you know what I'm talking about?
Yeah, the PRP, or is that what you're talking
It's
about?
like it goes through a filter. Yeah, that might be PRP. Yeah.
Oh, PRP is when you take the blood and you spin it and then put it back in.
Oh no no
Yeah.
no no! It's the one where you filter out your all your blood and all these
Yes.
toxins.
Yeah.
What's that called?
Um, I don't remember the name. I forget the name that's
Yeah.
called, but it's recycling your blood.
Yeah.
And they also can do it with lasers too,
Oh
like
really?
red light and laser therapy too.
Okay. What treatments that you offer do you want more people to know about?
Yeah, in the office we offer, peptides. We offer functional medicine, which is, specialty testing, nutrition supplements, dietary counseling, modification, lifestyle changes. We also offer brain treatments, which is the QEG. The QEG is the brain test, and
Yeah.
it looks at your brain waves. If your brain waves are too high or too low, then you have dysfunction, right? So you got ADD or ADHD or anxieties or depression or cognitive or addictions,
Yeah.
right? So that's the test. And then neurofeedback helps balance out those brain waves, and it helps you build new neuroplasticity, which is how you learn things in the world,
Yeah.
right? And learn new things. And so then we also offer peptide
Okay.
hormonal treatments, like bioidentical hormones,
Okay. So I do
peptide
know
therapy.
peptide's a big thing right now.
Yes.
Can people reach out to how would it go if someone was interested in peptides? How do they go? Like, how does do they if they already know what they want, or they just do an assessment with you?
Yeah, I
How does
mean,
that work?
we have people reach out because they've done peptides in the past. They know what they want. Obviously they would need to make an appointment, an evaluation, make sure they're okay and cleared to use the
Do
peptides.
they get them
Obviously,
same day, or do they get shipped, or how's that work?
no, they can either come to the office
Yeah.
or they can get them shipped.
Really?
Yeah. Yep. And so, that's one thing that they could do. Again, we offer the bioidentical hormone replacement treatments. And then, I refer out for other specialties that I do not offer yet. But my goal would be like try to get everything as a one stop shop.
Yeah.
I would love to have a facility, a place where everyone could just come and get all kinds of treatments in one facility. And,
Yeah.
financially, that one is the bit of a challenge, but
Yeah.
my dream and my goal is to make that happen so that people can, either come and stay or
Yeah.
come and, just do treatments on a daily basis.
Yeah. I'll have to talk with you about this because I do think that is, you know, a place for people to go. I think it's lack of education.
Yeah.
And people just they don't know what they don't know. And I think a time for if people are able to kind of go somewhere to just relax and let them just
Yeah.
and
Yeah.
whatever amount of time that is, how many days or
Yep.
weeks or whatever that may be. Um, yeah, I really do think that's an incredible thing to actually, want.
Yeah. And I think even, if you can't do that, if you can't go stay somewhere or you can't like dive in and dig deep. Sometimes it's just start where you can.
You could set yourself up.
Yeah.
My girl showed me this TikTok mom.
Yeah.
It's like cool little Asian lady. Her little at-home remedies. She hooks herself up so much.
Yeah.
Like you could really turn your place into, if you wanted,
Yeah.
to a little spa. Like you
Yeah.
can really adjust your environment. You're a product of your environment. And if you can go in and adjust your home, make it clean, you get your little scents going, right?
Yeah.
Do your little facial deals, all that.
That helps set up
You can do so much.
the spirit and the mind and the body, right?
Yeah.
You know, but at the same time, you know, people say, you know, well, I don't have the money, or I can't do that right
Yeah.
now. But again, what I would say is just start somewhere.
Yeah.
Even if it's doing one test, one treatment,
Yeah.
you know, one appointment at a time, starting now versus 5 or 10 years later, or, you know,
Yeah.
6 months later, because again, diseases progress.
Okay, with that testing though, I think it is good to have people have awareness on this too. And I do think the QEEG one is pretty amazing.
Yeah.
Neurofeedback blew my mind because I'm like, this is doing something? It was, but it's fascinating.
Yeah, it's amazing.
Now on the testing side, is there a specific test that you would suggest for, I mean, anyone that's new coming into functional medicine to look at? Is there something?
That's a great question. One
It's like
test
you should
that I would
know this.
Yeah, I mean,
These things, or whatever.
I would suggest doing a stool test for sure. I think if, you know, people can do a stool test, they at least get information which is controlling their gut and their brain. And there's always usually something to work on because most people have not worked on gut health.
Yeah.
Right?
Yeah.
Gut health can be leaky gut, and it usually is. And leaky gut leads to leaky brain, which is cognitive decline and autoimmune. So I think the biggest bang for your buck would probably be gut testing, stool test. You know, most people are getting blood work through their conventional doctor, even though it's very limited.
Yeah.
Again, most people are tell me, you know, I've been to the doctor, they did my blood work, and they said everything's fine, but I don't feel fine, right?
Yeah.
So those are the people that are not diseased yet, right? That have not crossed over into that disease pattern, but they're not feeling great yet. So their body is communicating with them, going, hey, something's going on. You don't feel well. I'm not running 100%. You need to pay attention or I'm going to break down.
Yeah.
Right? So I think the test I would say start with would be the stool test. You know, that's number one. And I'm a huge proponent on neurofeedback.
Yeah, it's fascinating.
I mean, I don't think it's very well known, just like functional medicine. I don't know why I tend to offer these treatments that are not well known.
Yeah.
That's not smart marketing, I guess. But it's because I really love what I do. And I think it's because it's not offered and it makes such a big change.
Yeah.
And it is the thing that will make or break health, right? That, like I see people coming to me that are severely depressed or anxious, you know, especially after COVID. You get a lot of anxiety because of, you know, being shut down from the world and trying to reacclimate, you know, or, you know, just the stress of the world.
Yeah.
Or, you know, TBI, so concussions, you know, that haven't healed, that, you know, people think can heal automatically, but they're still having symptoms and don't point it to the concussion.
Yeah.
But I see that a lot. And so the neurofeedback is life-changing for patients like that. Addictions.
Yeah.
And I tell patients, just show up, just come, get in the chair, show up and do the work, and you will thank me later.
I was talking with this guy, and Dr. Andrew Hill, about this. I think it was after 40 or 50 neurofeedback treatments, people it was like 85% would have 100% change. It was almost for like lifetime. It was like that long. Like I think it was his 40 or 50 treatments that he did the study at UCLA. And I think it was, 85% of people would be changed for life, like totally reprogrammed.
It's absolutely true. And you're right. It is reprogramming the brain. Wow. It is how we respond to input.
Yeah.
How we respond to, you know, the world, how we respond to ourselves,
Yeah.
our talk, our mental talk,
I know.
and our nervous system, which again, nobody really thinks about. All that affects your nervous system, and your nervous system is the thing that controls all of you, your body, your
Yeah.
organs.
So with all that though, because someone comes in, it's a lot of information, a lot of education, right? Like a formula or a framework for life. Like, do you give them like, hey, we went over these things. This is going to be your way of life for 2, 3, 6 months, or for life. Your daily rituals and habits. Do you just implement a plan, like you drafted up a piece of paper or whatever it may be, like this, run your life in your system and treat your mind, body, and spirit like this?
Yeah.
Because it's so much information, right? But I get it sounds like while they're working with you, they're getting really educated, and now they just have all this awareness, huh?
Yeah,
That they didn't before.
definitely for sure.
Yeah.
Education is part of it because again, a lot of people don't know what functional medicine is or integrative necessarily. And again, really it's just a more natural way to heal.
Yeah.
Right? And it's really things that we should be doing ourselves that we've forgotten about it or don't do them all together.
Yeah.
Which make a big impact. And yeah, so what I do is typically when my new patients, I spend about an hour to two preparing for each new patient.
Oh wow.
And so I go through their history, I go through their, hospitalizations, I go through their symptoms, their medications, all this kind of stuff. I evaluate their labs if they've uploaded any previous labs. And then I write down some questions that I have for the patient, and I design a plan based off of what I see. And that plan I use, I've designed a roadmap, vitality roadmap,
Okay.
where
I saw
we're
that.
looking at all the different approaches and systems. So you can see that we're going to look at this, we're going to look at your, diet, your nutrition, your sleep, look at foundations, right? And then we're going to go up into the gut, and then we're going to look at the hormones, and then we're going to look at the brain. And so we're looking at all these systems. We're looking at your toxic burden. Have you been exposed to mold? Have you had mercury fill-ins,
Yeah.
So I look at all these aspects, and each one tells me something or could be a trigger. But I also look at their timeline of life. And in a history, I get a lot of the timeline, some of the timeline, I should say, but I also sometimes have patients write their timeline of life when they were born up until now, the positive and the negative things of life that have happened. And so then it helps me look at maybe some of these are triggers.
Wow.
And then I design a plan of treatment based off of that. And it could be, anything from anything. Again, it could be lifestyle changes, diet. But I really spell it out, and I tell people what to eat based off of what they, test for or how they're feeling. I like doing food sensitivities for that too.
Yeah.
And then, we say, okay, we're going to start here, or I say we're going to start here. This is where I would like to start. And then, we're going to work on this, this, and this while you're here, depending on how much time you give me.
Yeah.
If you give me, enough time, then we'll finish all these things and get you into a maintenance. If you don't give me enough time, then let's just focus on this. If you give me 2 months, then let's focus on this. And by doing, an approach that's more methodical.
Yeah.
Right? And then I like doing retest. Not always do I get to do retest because patients maybe don't want to spend the money. They'd rather keep that money and use it for treatment, or some patients like retest. And
Yeah, you can just track their progression too, right?
Yep.
I mean, you can do that with neurofeedback or the QEG, right? This was
Absolutely.
overactive. Let's
Yeah.
test you again later.
Right.
Wow, look, now it's balanced out.
Yeah.
Or even their hormones and all their micronutrients.
Yeah. And progression too, for a lot of people, are like, I'm feeling completely different than when I started, right?
Yeah.
I'm like, Dr. Vaughan, I don't really think I need to test. I feel great.
Yeah, just based on, yeah.
Yeah. So I'm like,
Totally.
Of course I would love to, but sometimes I'm like, yeah, you're doing really good. So I understand.
Wow.
Yeah.
Yes, I think that's the thing that needs to get into behavioral health after owning and operating treatment centers the last 12 years of being all around it. I think functional medicine is not in treatment. And there is hundreds of people cycling through these programs all month long, right? But not one of them has ever grown up understanding this, has no knowledge. It's not in their social media algorithm, whatever it may be.
Yeah.
And I think that's a piece that's kind of one of my missions right now. And it has been just kind of kickstarted not too long ago. It's really interesting. Probably because I've had a really good change. But I really, really believe that needs to get into behavioral health.
I agree with you,
Yeah.
Preston. I this is why I resonate with what you're doing right now, because one, I think, people going to rehab and trying to make a change, whether it be, drugs or alcohol or whatever,
Mm-hmm.
right? Recognizing that that's a problem and that's not working and they don't want to do it anymore is hugely, like, courageous.
Yeah.
Number one.
Big time.
So I wouldn't think you'd want to do it twice.
Yeah.
Right?
Yeah.
So for that reason, I think if other rehab facilities or your rehab facility implements this like you're talking and we're talking about, that the state of recovery and the length of recovery will increase.
Yeah.
And will have, positive effects, because for me, recovery's not just about like getting clean and sober.
No.
And a lot of times that is what it's about at first, right? Yeah. But if you're not looking at what drove the need for, whatever,
Yeah.
The mind, body, spirit disconnection, right? Then more than likely the relapse effect will happen again.
Yeah.
If you're not really, well, maybe not more than likely. Let me just say a high percentage, right?
Yeah.
But I think the success rate of staying recovered and staying clean is, when you look at recovery, is not just about me not drinking or putting drugs in my body, but also embracing the fact that I want to heal.
Yeah.
And I want to look at my, my past life, what I did before. I want to heal that. I want to look at my health, because now I've turned on some genetics from the epigenetics of the drinking and alcohol. So my body's not like it used to be. So now I've probably turned on some disease process that I need to downregulate. But I also, and I still want to get my mind, body, and spirit, all in sync. But I want to look at this also as a spiritual process, which might be hard in the beginning.
Yeah.
And again, just trusting someone that trusts the process, like you.
Yeah.
And that's been there before, like me.
Yeah.
Right? How to do these things. That's where you hire someone to help you and mentor you.
Yeah.
Right? Whether it be in recovery or functional medicine or whatever the case may be, because when you embrace the holistic approach and whole health approach, I think recovery becomes stronger.
Big time. 100%. Well, did we miss anything that on our whole little journey of talking right now?
I'm sure we missed a lot, but
We'll
we covered a lot
again.
too. I think the most important thing is there's a lot of most important things, but number one, I think it's important to try to live your best life, right? That's the most important. Enjoy life. You only get one life, right? So make it the best.
Yeah.
And, evaluate it. And if there's places where you're not happy, then dig in and focus on it and work on it, whether it be, recovery or your health, right? And, oftentimes one step leads you to the next answer or solution. So it's a journey. Health is a journey. This life is a journey, right?
Yeah.
So just take one step at a time. Go towards, where you're led. Also trust that your body can heal and that you're meant to be more.
Yeah.
Right?
Yeah.
You're meant to be more. You're meant to do more. You have a purpose. Every one of us has a purpose. And, you know, some days are better than others, you know, and I want to wake up and be a better version of myself every day.
Mm.
Some days, you know, I'm like, wow, that was not a good day, right? But most days, I'm like, okay, check.
Yeah.
You know, I think, you know, just embrace life, and the journey is the most important part. And if you're struggling with health issues or, you know, recovery issues, you know, I know Preston is really passionate about what he's doing. So
Yeah.
um, I'm looking forward to a synergistic kind of approach in
Yeah.
health. And yeah, just go for it.
All right, Kristi. Well, thank you so much, and we're gonna be doing this again soon.
Yeah, well, thank you.
Cool.
If you need me or they need me, they can call the office.
Yeah.
You know,
What where how can they find you?
they can call the office at 714-434-9355, and that's Vaughan Vitality Wellness. Or you can look at Vaughan, VAUGHAN, Vitality, VITALITY.com.
Awesome.
Yeah, thank you.
All right,
Thank you,
Susan,
Preston.
you're down. Come on, you're next. Thank you,
Actually,
guys.
yeah.